Hi, I'm Stephanie with the Note Ninjas, and together with Nicole, we are a PT OT duo that help other PTs, OTs, and assistants with treatment ideas and documentation. So today I want to talk about our patient that presents with a shuffling gait pattern during ambulation. We all have these patients, and it could be that it's a cause of Parkinson's or another neurological issue, or maybe it's just a weakness in their hips or their glutes. Maybe they just have a fear of falling, or maybe they've just learned to walk this way from past experiences. Whatever it is, we really want to help them improve the shuffling gait because, as we know, that can increase their fall risk. And it could be slower to get around. It might prevent them from going out to the food store out with their children. So, what can we do for the shuffling gait? So, we can do regular activities like lower extremity strengthening, core strengthening, some leg swings, some other balance activities. Or we have an idea for if a patient is using a walker. If they have a walker, we can use an external cue. So we've all seen those walkers with a light that your patient has to walk over it. But sometimes that's not doable, or sometimes they don't want to invest in that. Or maybe we just want to try something out and we're just going to use this during therapy in hopes that it translates into their life without it. So if they have a walker, we are going to take a TheraBand and we are going to tie it around to the bars. That is going to act as an external cue. So when our patient is walking, they have to touch the TheraBand with their legs. Let me show you in a quick video. So you see how easy this is to set up. All you need is a TheraBand on their walker. And a lot of times just having your patient increase their step length, telling them to make sure they touch the TheraBand with each step will get them taking longer steps. And as they continue to do that, they should hopefully be able to take longer steps in their day-to-day life. And make sure you document this. Patient presented with shuffling gait pattern or decreased step length. Therapist put a TheraBand around the walker as an external cue to increase step length. Patient was able to complete 100% of the time, maybe 50% of the steps, whatever it is, make sure you document that because that could show progression. Or if it's 100%, it shows that your treatment worked right away. And then use it, maybe have them walk around for 5-10 minutes, take it off, and then see if their gait pattern stayed and document it. Did it not? If it did, great. If not, maybe why not? Maybe let's just continue this for a couple more treatments and continue to assess the patient. Maybe they needed some education. Maybe it's more of like a fear of falling kind of thing. And they need the education that you just did it, you can continue. Whatever it is, make sure you document that. And maybe while doing it, they required other kinds of cues or assistance or guidance. Maybe you had to keep cueing them to make sure their leg hit the TheraBand. Or maybe they also required assist to make sure they stand up tall because now they're looking at the band. You need to tell them, you'll feel it. You don't need to look at it. Or maybe they needed some physical assist for loss of balance. Whatever the reasoning is, make sure you are documenting that if you are cueing them, which we normally are. So remember, in your documentation, explain how your patient presented, decreased step length, what you did about it. You put the TheraBand on the walker as an external cue. How did your patient present? Did they need other kinds of cues while they were performing this activity? And then when you took it off, were they able to complete it without the band? Why? Possibly why not? What are you going to modify? What are you going to change? So we hope this helped, and we'd love to know if you try this out with one of your patients and how they did. So make sure to follow us at the Note Ninjas for more treatment ideas and documentation tips.